In this condition, we will be dealing with abruptio placenta. First, we have to define what is it. It is a premature separation of a normally implanted placenta from the uterine wall, which occurs after 20 weeks and can happen till the delivery is complete. It complicates around 0.5 to 1.5% of pregnancies. Yes, that comes to around 1 in 120 births. So the severity of abruption may vary from mild to severe. Severe being, it can lead to death of the fetus, which happens in around 1 in 500 cases of abruption. And around 1/3 patient of antepartum hemorrhage is because of abruption. And it is also called as accidental hemorrhage because it always happens all of a sudden. There is no time for us to identify. Identification should be made on the clinical ground and the action should be taken immediately. So before going into the management part, we'll look into predisposing factor. The most common predisposing factor for abruptio is maternal hypertension. If there has been a history of placental abruption in previous pregnancy, there is high chances that in the subsequent pregnancy, patient might have abruption again. Any trauma, whether it is a road traffic accident or if they are going any obstetric procedures like external cephalic version or photosynthesis. In polyhydramnios, if there is a rapid decompression, as in we see in cases of diabetes mellitus or multiple pregnancy, in cases of premature rupture of membranes, if there is a short umbilical cord, it gives traction and leads to premature separation of placenta. If there is history of maternal tobacco use or smoking cigarettes. Folate deficiency, anemia, increased maternal age, thrombophilias are other causes which we can attribute as a cause of abruptio placenta. If in case of dual marker test there is unexplained maternal AFP levels, we can suspect that the patient may present with abruptio. If there is any uterine abnormalities or is associated with uterine fibroids, the suspicion of abruption should be there if patient presents with bleeding and pain. So as I have told already, the most common risk factor is maternal hypertension. It can be either chronic or preeclampsia. If a patient had abruption in one pregnancy, there is 10% chances of having abruption again and 25% chance if patient had abruption in 2 prior pregnancies. Around 50% of the placental abruption which is associated with hypertension is generally very severe and can be fatal to the fetus.